Hi everyone, I'm very excited to welcome you to this episode of my career story. Thank you so much for all the exciting feedback about the previous episodes, and I'm sure you're using it to add value to yourself and other people. So today we have a very passionate and experienced physiotherapist and a big sister in the studio with us. And she'll be sharing insights on building a career in physiotherapy in Nigeria and how the medical sector functions with people like that. So it's going to be exciting. Thank you so much for joining us, ma'am. All right. So I'll go ahead and introduce her so that you have an idea of what to expect. Mrs. Adedayo Bolagun is a licensed physiotherapist by profession. She attended Queen's College, Yaba, Lagos, where she graduated with distinctions in 2006. Her first degree, she proceeded to Obafemi Awolowo University, where she bagged her first degree in medical rehabilitation with specialization in physiotherapy, and she has worked at reputable government and private hospitals in the course of her almost 10-year-old career. She currently runs a successful private practice in Lagos State. So it's great to have you once again, Mrs. Bolagun.
Thank you so much for having me.
You're welcome. I'll jump right to the first question. So what would you say physiotherapy is all about? You hear science students say they want to be doctors, nurses. Very few of them mention physiotherapy. So can you walk us through what it's about?
All right, thank you once again. Welcome everyone. I'm so delighted and happy to be here with you today. Physiotherapy basically is a health profession. It's a medical profession that uses non-drug means, non-pharmacological means, but I want to make it as simple as possible. So using non-drug means to treat conditions that are amenable to physiotherapy. So to treat conditions that we believe that non-drug methods, are the best ways to attend to them. This include, bone conditions, bone injuries, muscle injuries, fractures, accidents, and a whole lot. But physiotherapy basically is a health profession that uses certain modalities that include heat modalities, exercise therapy, electrical stimulation, and other non-pharmacological methods to treat conditions, medical diseases, diseases and other health conditions. That's generally what physiotherapy is all about. So just like you said, many young people coming up don't really know much about physiotherapy, but we're going to be delving into that, in the course of the program. So just stay tuned. There's a lot coming up. But in summary, physiotherapy is a healthcare profession. You are not subservient to any other person. You're a qualified health professional, and you attend to conditions using certain modalities that we call physiotherapy modalities. All right. Thank you very much for that question. I'm going to answer that question with a story. I always tell people of my own journey into physiotherapy. So when I was in secondary school, I think junior secondary school, my younger sister was, but later in the practice, I got to know that she had injection neuritis. That means she got an injection that was given at the wrong location, somewhere near her buttocks. And then the injection happened to injure one of her nerves. And that's the nerve that controls movement in her feet that makes you walk properly. So in short, my sister began to limp. She had pain. The leg started getting thinner compared to the other leg that wasn't injured. She couldn't walk, to school, and we're also worried. So we got to see a doctor, and doctor said, oh, there's no drug, there's nothing they can do about this. She has to be treated by a physiotherapist. That was my very first encounter with anything physiotherapy. So we headed to the Lagos State University Teaching Hospital at Ikeja, and then we go to meet a physiotherapist. So in my young mind, after about 4 weeks, 6 weeks of treatment, we're going there. And I was like, wow, what's this therapist in the society not be overemphasized? I mean, say we are the ones who hold the hands of our patients and help them to lead normal lives, much longer after lives. All right, so physiotherapists, let me go into them now to explain more. Physiotherapy is divided into, we have orthopedics, and by awareness, let me also say that most people that even know something about physiotherapy, the next thing they think about is bone. Whenever people are physiotherapy, they think of bone and they think of massage. Those people that just massage people or those people that arrange people's bones. So let me say here that physiotherapy is a whole lot more than that. It's rigorous, it's tedious medical study of 5 years, now 6 now. So I started with the 5 year set, but it's now 6 now, 6 years now. So physiotherapy majorly is divided into orthopedics. We have the orthopedics section. We have the pediatrics. Orthopedics deals with bone injuries. So then we have talk about fractures, talk about bone strains, muscle strains, sprains. We have pediatrics. We talk about vaginal tears. We have physiotherapists that deal with all of that. We have physiotherapists that deal with geriatrics. That's old people, aged people. Even though in Nigeria we don't really have a saying. We have physiotherapists that attend to the people that we classify as geriatrics, segment of society. That's old people, aged people. I was saying that even though in Nigeria, our geriatric care is not really so organized yet, but we have physiotherapists whose work is to help and work with elderly people, old people. We also have physiotherapists that do respiratory care, so people that have breathing issues. And I must say, even during this COVID, physiotherapists, especially outside the country where they have a lot of COVID cases, physiotherapists have been working assiduously, saying that the COVID-19 is much of a respiratory disease, to help patients to breathe. So we have physiotherapists that deal with that. So we have the orthopedics, we have the pediatrics, we have the obstetrics and gynecology, we have the geriatric, and then we have the respiratory physiotherapy. There are newer branches that are coming out now, but those are the major branches of physiotherapists. So in all of these segments, physiotherapists play an important role. Now, let me start by saying that the central role of a physiotherapist is 3 basic things: to restore function wherever function has been lost, to improve mobility. That's mobility is the ability of the person to move about as independently as much as is possible. So if physiotherapist wants to restore function wherever function has been lost, function can be lost due to an injury, due to an accident. Someone may have had an accident, had a fracture, and has to be on a wheelchair or use crutches. In that place, we say function has been lost because he or she cannot do what he could do prior to that injury or prior to the mobility. And then to relieve or remove pain as much as is possible. So everything a physiotherapy does is winding around, these 3 things, and they are all inhibit their function, and then that's reduce or totally inhibit their mobility. So this is where physiotherapy is coming. All right. So in the medical, let me start from medical setting now. A physiotherapist is a part of a general healthcare team that comprises of doctors, nurses, medical laboratory scientists, dentists, opticians, optometry, everybody that works in a healthcare setting. A physiotherapist is considered a medical professional who is part of the larger healthcare setting or a larger, what we call a healthcare team, with the patient in focus. Okay, so just imagine that there's a patient in the middle and I'm drawing a circle, consisting of different healthcare professionals. And then there's an arrow coming from each healthcare professional to the patient. So the patient is the focus of this healthcare profession. So the physiotherapist is a member of such a healthcare team. All right. So what we do, we assess patients, we diagnose conditions, and then we come up with treatment plans in line with what the outcomes of that patient is. All right. So let me take an orthopedic case, for example. So Mr. Daniel is a carpenter. So he had an accident on his way to work, and he was rushed of an hospital in a Keja. So the doctor saw him in. He's wondering what has happened. So he's been stabilized by the doctor. The nurse on duty helped to, first of all, clean the excess blood and wound and just stabilize him. And then an X-ray has been done. And in the X-ray, we found out that Mr. Daniel's thigh bone has been broken into two parts. His right thigh bone was broken into two parts. So the doctor says, oh, I need to call in an orthopedic surgeon. He's going to need a surgery. So the orthopedic surgeon comes. You can see all the people I've listed now. I've listed a nurse who cleaned up the excess blood. I've listed the doctor, just a doctor on duty. He ordered for an X-ray and stabilized the man. And then the X-ray was done by the radiologists, the medical lab people. So he sent in the X-ray, and the doctor reviewed the X-ray and said, oh, there's a fracture in his thigh. So he calls in the orthopedic surgeon, who is a specialist in repairing broken bones and handling fractures. And then they insert metal rods or do the procedure to make sure that the two bones are aligned. And then Mr. Daniel is a carpenter, so he can't be holding crutches and then be doing his carpentry work. He needs to be able to get to a point where he can do away with the crutches and return back to life as he knew it before the accident. So they invited the physiotherapist to come in. So the physiotherapist assessing Mr. Daniel as Mr. Daniel I'm going to measure you, take your measurements, get the right size of crutches for you, and then I'm going to teach you how to use these crutches. All right, so the physiotherapist in question is me. The physiotherapist comes in and takes Mr. Daniel from a man with a fractured thigh bone to a man who can walk independently, and in 6 weeks is ready to return back to his work. That is in a healthcare setting for somebody who had a fracture. So as a physiotherapist, I'm going to come in there. I get to spend the longest time with Mr. Daniel because he's afraid. He thinks he's going to fall when he's working with the crutches. In fact, when the 5th week, he's saying he's not ready to ditch the crutches and start using a walking stick because it's my to one walking stick, and then finally make him confident enough to stand and put weight on that ill leg again. I must tell you usually we build relationship with our patients because when somebody is at that low level, it takes a lot to connect with them and to hold their hand and assure them that you are going to be all right again. All right, so if the therapist is the one, long after the surgeon has inserted the metals into the thigh, you're going to hold the hand of the patient and ensure that they go back to function, to mobility, to their lives as though the injury didn't happen. So from getting the right crutches for the patient, training the patients to walk with the crutches, helping the patients navigate staircases with the crutches, building confidence back in the patient that you can walk again after this accident. So actually, seeing the patient go into their previous life, follow-up appointments from home to the physiotherapy clinic till when the patient is certified fit to walk and do normal things again. That is how physiotherapist comes in. We also work with stroke patients. Oh, stroke is when there's an assault in a part of the brain. So the left part of the brain controls the right side of the body, the right side of the left side of the body. So in a stroke, there's a loss of function because certain parts of the brain, which are supposed to control certain activities in the body, those parts of the brain are assaulted. There are different reasons for stroke. I'm not going to go into that. This is not a stroke, it's not a stroke enlightenment class. But I'm just talking about there's a loss of function that really comes full force with stroke. Many people lose the use of a whole side of their body. Some people it could be the left side, some people it could be the right side, depending on which part of the brain was affected. There's no drug that you can be given to improve, to restore the function, you are going to take the patient through what we call stroke rehabilitation therapy. I mean, and it's as basic as you have to start all over teaching patients how to wiggle their toes, how to move their ankles, you know, and in fact, when the paralysis is from the face, from half of the face down, half of the body, you have to teach the patient to smile again, to blink their eyes, to wrinkle their forehead. I mean, it doesn't take less than an hour per session of physiotherapy. So you imagine spending that much time on one patient. You're going to be talking along the line, encouraging them because they deal with depression. Many of them used to be active people that now need people to carry them around. They can't go to urinate by themselves. So that, first of all, is a psychological aspect. So as a physiotherapist, you are a psychologist, you're a counselor, you're a listener, you're a communicator. You have to get into the mind of your patient and really motivate them that you can overcome this. So we deal with stroke, we deal with fracture cases, with the children's aspect. There are some children that are born with certain disorders, things like Erb's palsy, things like cerebral palsy, children who are not growing at the level of development that they are supposed to go, you know, through. I currently work with one child like that, you know. So you have to begin to teach the child, put the child through exercises, repetition exercises to teach the child how to sit, how to stand, how to walk. So I can go on and on. The role of physiotherapists in pregnancy and antenatal care is so important. And thank God in Nigeria it's becoming more recognized now. You know, where I used to work, I run antenatal classes for pregnant women because we have found out that a woman who gets good exercise and, you know, and antenatal care during that period is more likely to do better during labor, and a recovery even after labor is also much better than a woman who didn't go through that. So we have pregnancy exercises, routines, breathing techniques, relaxation techniques, things we teach the women that help them do well working in with elderly people, in old people's home, and even in the hospital setting where old people come in. So a lot. And we also have physiotherapists who work, I forgot to mention, sports medicine and sports physiotherapists. So most of the teams, most of the football clubs, most of the teams, they always have more than at least 2 physiotherapists that work with them. You see those people that attend to footballers on it. I'm going to correct that today. With ice, when somebody has, you know, he fell down during the match, and then you see people bringing ice, stretching, massaging, moving him. They are physiotherapists. Every sportsman, you know, in the world today, usually they have physiotherapists that work with them, take them to exercises, routines to keep them in shape. Athletes, footballers, basketballers, name it. In fact, one of our textbooks that we use in Nigeria, a UK textbook, was forwarded by the popular footballer now, Michael Owen. He was one that wrote the forward, and he appreciated his team of physiotherapists for bringing him back when he had a major knee injury. So physiotherapists, I mean, I could go, I'm talking majorly in the Nigerian setting, because outside the country is a whole different ball game. In fact, a few years ago, Department of Labor in the US, physiotherapists was the highest paid.
Wow.
Medical profession as at then, followed closely by IT. But I think now the way they value physiotherapy services, because now the world is moving towards preventive medicine. People are beginning to discover that intake of drugs are giving. They are beginning to find out that it's not safe. So now the world generally, even the WHO, is advocating for preventive medicine, pharmacological treatment. That means non-drug treatment of certain that are suffering from diabetes, stroke, hypertension, just by making lifestyle changes, which include getting regular exercise, eating healthy, being physically active. We have found that that alone can reduce the risk of those chronic conditions and diseases by almost 50 to 60%. So that's where the world is going towards now, preventive medicine. non-pharmacological treatment, of disorders. And physiotherapists have a lot of role to play when it comes. So in the hospital setting, in summary, a physiotherapist is a major team player in the general healthcare team that can assess, can diagnose, and can treat medical conditions that require physiotherapy intervention. In fact, the hospital I worked last, I discovered that we're having patients and who are not being referred to physiotherapy. So we called a meeting with the doctors and said, what's going on? We can do this, do this, do that. And they said, wow, they didn't know physiotherapy could handle all of these cases. I tell you, within the next 1 month, we were overbooked. They just kept sending all the and I was like, I hope we have not shot ourselves leg. We kept having, so doctors now began to see, and then it made their job easier, because if you come in, I'm having this chronic back pain, and then we had patients that for almost 3 months, 6 months, they're about to be swallowing paracetamol, diclofenac, and then they began to start having side effects like ulcer, because their stomach had to be constantly pushing out chemicals. And the patients themselves begin to say, we are tired of taking drugs. We are tired of swallowing drugs 3 times a day, and then the back pain is not going, the neck pain, the shoulder pain is there every time. And then we said, send them over to physiotherapy. I tell you, 2-3 sections with us, they go back to see doctor. Doctor, I'm fine now. I'm just going to, and then the patients, they kept, the hospital began to find out, this is really, really working. So physiotherapists, because people now also, the generation that we are now, people are more aware. Somebody has a condition now, he goes on Google, he knows everything about his condition, and he sees that drugs cannot actually take away that pain. They are just going to give him a sense of false relief. After 4 or 5 hours, the pain is back. So even patients now are looking for alternatives. Like, I can't keep on swallowing drugs, all the time, and then I'm not getting permanent pain. That's our call, and to improve movement and mobility in care. So in the society setting, physiotherapists also, as I said, physiotherapists work with volunteer children's home, like an orphanage, where they bring abandoned children.
Hello?
So some of them, they had some issues at birth. The center where I work is in association with Lagos State, all manner of settings. I've also gone to get into children with disabilities. That's one major way physiotherapists work. In fact, I know physiotherapy colleagues who go to volunteer at orphanages, at homes for children with disabilities, who put them to exercise, help them to walk, help them to move, help them to at least come back to function as much as is possible, even with their disability. So in society, physiotherapists work in all those kind of settings, in orphanages, very large, important role to play, in those settings, both within the hospital setting and then outside the hospital setting.
Wow. I hope I want to be doctors when they hear this.
Yes, and we need. I'm telling you, the ratio of physiotherapists to patients in Nigeria is embarrassing, is terrible. That, for lack of a better word, we have very, very, in fact, in the whole of Lagos, registered physiotherapists as at last year, I don't think we're up to 1,000.
Wow.
Because we discussed that during the annual physiotherapists conference, which we usually do. It's if you're in Lagos now, physiotherapy care, you need to either go to tertiary healthcare facilities like LASUT or LUT as Idiaraba, or a few general hospitals. Only few private hospitals offer physiotherapy services, and it is very, very at an expensive price. So if we have more physiotherapists, more people coming to study the course, it's going to really go a long way to improve the access that patients will have to physiotherapy care. So I'm hoping that people who are listening to this, young people out there, I want you to, consider this, go online, study more about the course, and then enroll. It's a fulfilling course. Recently somebody sent a picture of a son to me. He was born with some disability. and then he couldn't do the things that other children do, at the time that they do it. So he had some form of delay. We call it delayed developmental milestone, DDM. It's a condition for children. And then we're working with this boy 3 weeks to his 4th birthday. So when he was going to become 4 years old, he began to walk. The mom sent me the video and said, Physio, your son, your boy is walking. I mean, those are the things that it's just fulfilled. Money can't buy that. Money can't buy when a patient sends me the picture of her daughter, which could not use. As a physiotherapist, you get to become a part and parcel of your patient's life. You don't just write drugs and the patients go. You are going to hold their hand. Sometimes you massage them. Sometimes you carry them. Sometimes you hold them. Sometimes you cry with them. Sometimes you just sit down and listen to everything they have to say. And then you just encourage. So one of the major things that, made me go, and this notion that, most people that are in other health profession, maybe they wanted to become a doctor and they didn't make the pass mark and then they treat them physiotherapy. No, I enrolled for physiotherapy as my first choice course. So it's not a dumping ground. And in many universities in Nigeria, like the school where I finished from Obafemi Awolowo University, you can't switch from nursing to physiotherapy. You can't switch from medicine to dentistry. All the courses in the College of Medicine, we see them as callings. So if you want to be a nurse, you can't be a nurse and say, I actually wanted to be a doctor. No, it's something that you are there because we're dealing with lives, with human lives, with the quality. So you have to be passionate. You have to, this is what I want to do. And that's why the medical training is so rigorous, because if an accountant makes a mistake or balancing books, it's all just about money. You can get the money back. But if somebody handling human life makes a mistake, it can cost somebody their whole life. It can cost somebody the ability to walk again. It can cost somebody the ability to move around again. So it's something that you want to do. So it's not a dumping ground that, if I can't be a doctor, if I didn't make cut off for medicine, no. It's something you have to want. And when you know much about the course, one of the things, as I was saying, one of the things that made me venture into physiotherapy was because, of course, first of all, I saw the work that they did with my younger sister. And secondly, I found that to be an exceptional physiotherapist, your communication skills and then your listening skills have to be on point. And I am a communicator. As you can see in the seminar, I can talk like this for the next 5 hours and it will be fine, even with this interview. I'm a communicator. I love talking with people. I'm not an impersonal person. I just, you walk into my office, I say, what's wrong with you? And then I write some pills and then that's all. No, I'm a people person, and it makes me an exceptional physician because I found out that sometimes when patients come into my office and we talk for some time, I ask them questions, I explain their condition to them, I ask them, do you understand what's going, this is what we're going to do. Already 60% of the pain, they already feel better, just knowing that they are comfortable with this physiotherapist. This physiotherapist understands them, knows exactly what, but doctors really, because of the nature of their work and because of the number of patients doctors have to see, there's really not too much of time for talking with the patient for almost an hour, okay? And so that's why in an average working day, let's say 9 to 5, a physiotherapist can see maybe just about 8 patients. And so that's why some people feel that, doctors are more busy. Well, this is not a doctor versus physiotherapy stuff. But physiotherapists, we take more time with patients because we have to touch them, we have to massage, we have to talk, we have to motivate, we have to encourage. Sometimes we hold their hand, so it takes more time. So I'd like to encourage every young person, if you feel that you have a passion for helping people, you have a passion for medicine now, helping people in line of medical care now, because you are going to go through medical training. So if you have a passion for medical care, you want to help people, you are a communicator, you feel that you'll be able to help people walk through pain, help them restore, restore function, help them enjoy quality of life. That's one of the things we also do, improve our patients' quality of life. Physiotherapy is the place for you. You're going to have a very fulfilling career.
Wow.
Yeah.
This is so good. is so, thank you for going into the detail and the passion. Like, it's powerful. Thank you so much. So we want to know your story.
Your work is a pleasure.
Thank you.
It's a pleasure, absolute pleasure.
And your journey in so far, though you've highlighted a few parts of it, but we want to know what the process is like to becoming a therapist in Nigeria. You've spoken about the specialization and the opportunity. So what's the process to becoming a physiotherapist? What was your journey?
Okay. Well, as with all science-oriented courses, based on last thing I know about WAEC, you have to have at least 5 credit passes, including physics, chemistry, and biology, and I believe maths and English, because those are already so you have to. And for anybody who even wants to go into that, I would the 5 credit passes is just WAEC standard. I would prefer that you get distinctions, at least B's, okay, in your science courses. So you have to be a science student. Let's start from there. You have to be in the science combination in secondary school. That is one. When we will get to pick. So then getting into the JAM, you have to, of course, do very well with your JAM exams. And then the universities that do the post UTME, you also have to, definitely do well in your post UTME. So for academic qualifications to entering, I think those are the basics. You must be a science student with passes in your physics, chemistry, biology, maths, and English. You must also endeavor to get very high grade, because everything in the College of Medicine, all the courses, be it the medicine itself, dentistry, physiotherapy, nursing, and some other universities like Uniben that have optometry, that's for the eye specialists. All the courses they are highly competitive courses, because in the labor ladder, everything that has to do with medicine and healthcare generally is considered a priority. People believe health is wealth. When a nation is fine in their health, then the people are more productive. Okay, so that's why a lot of priority is always given, to healthcare in any country of the world. So all the courses in the health professions, they are actually very competitive. So I will encourage anyone, you need to be hardworking, you need to really do well in your subjects at the WAEC level, and then do well in your JAMB, and also do well in the post-UTME. Now, if there are other conditions that vary from university to university, at the point of admission, I believe they will be informed. But generally speaking, those are the conditions for the academic qualifications for being a physiotherapist. Now, when you gain admission into physiotherapy, you will usually be in the College of Medicine or some universities. I went to Obafemi Awolowo University, so we call us the College of Health Sciences. So most schools call it the College of Medicine, Medical School, College of Health Sciences. So however way you'll be with the other healthcare colleagues. In 100 level, we do all that's just the introduction. So everybody in the science and microbiology, everybody is doing almost the same courses. Chemistry, physics, biology, all the general courses, everybody does in 100 level. But by 200 level is when everybody now moves fully into the college. For example, if you go to Unilag, in the 100 level, you are still at their university campus at Akoka in Yaba. But 200 level, you move to the college, University Teaching Hospital, that's LUTS, Lagos University at Idiaraba. That's when you now begin the medical training. But 100 level is still general. And I also want to say here that the 100 level is critical that you make all your grades there, because there are every university has their benchmark. If you don't get a certain grade point on a level, you will not be allowed to move into the college fully. Yeah, so that's why I said it's not a subsidiary, it's rigorous training. It's really rigorous. Okay, so, but that's not to scare you. It's doable. I did it. Many other people are doing it just with hard work, with dedication to your academics. You're going to scale through. So once you enter in the 100 level, you are doing the physics, the chemistry, biology. You are doing practicals in physics, chemistry, biology. You'll also be allowed to take an elective from another department just to add a knowledge to what you're doing. and there's one or two other courses. So I think we have a total of about 24 grade points for 100 level. So when we now, get into 200 level, that's when you now become fully inducted into the medical training. From 200 level to 400 level, we are all doing the same courses: doctors, nurses, dentists, optometrists. You do your basic anatomy, knowledge of the human body from head to toe. We do basic physiology, knowledge of how the body functions, the chemical processes that the body functions, 200 and 300 level. And then you do biochemistry, medical biochemistry, knowing the chemicals and all of that makes the body work. So in 200 to 200 level, 300 level, everyone is, because those are the foundations of being a healthcare professional. So you'll be in class with your doctor colleagues, nursing colleagues, dentist colleagues, optometrist colleagues. We're all in class together. So it's at 400 level now that everybody now goes to another final specialization now. So the nurses now begin to focus more on the nursing. Dentists now begin to do their dental procedures. Physiotherapists now begin to go to the hospital, begin to see patients under the guidance of senior physiotherapists, and then the doctors also. So it's full-blown medical training. We get to, in 200 and 300 level, you get to work with cadavers, you open up dead bodies, so because some people with physiotherapy, all they know how to do is just to massage. They don't know no. I've held the human heart in my hands during my anatomy cadaver days. Yes, wow. I've opened up. So when I'm massaging a patient's shoulder, in my head, I know all the structures that are under the skin. Wow. And that's what differentiates a physiotherapist from a traditional bone setter. Because some people, there's a group of charlatans coming up, especially in Lagos, that parade themselves. Yes. That somebody, in fact, I wish I recorded the conversation. Somebody called me yesterday or 2 days ago to attend to his wife. He said she had an accident and they took to local bone setters. And then for 8 months, no improvement. They eventually have to go back now to surgery after 8 months of the accident. And now they are needing a physiotherapist. And it's a lot of cases like that. So that's what differentiates a physiotherapist from a charlatan, from a traditional bone, all these bones, people are calling themselves bone doctor, traditional people. No, a physiotherapist has undergone rigorous medical training. So when a physiotherapist is bending your elbow, she knows all the blood vessels that are passing through the elbow. She knows how long to put your hand in the POP so that blood flow is not impaired. So when a physiotherapist is massaging your back, she knows all the structures that are under the skin. When you go to, and another area where physiotherapists can work also is gyms. Because I've had patients come to me who went to a gym, lifted some weights, and then they fractured their back, or they had, disc issues with their back. Okay, because there's also a part of physiotherapy that is called sports exercise therapy. That's where you go everything sport. There are procedures to be there. There's the way you exercise somebody who has diabetes. There's the way you exercise somebody who has hypertension. There's the way you exercise somebody who is just recovering from a surgery. But so some people just go to gyms. They don't check your blood pressure. They don't know if you have eaten them. They don't know your blood sugar level. They just begin to, Oga, carry this weight. And then the person, so there's a lot of things going on. And that's why we need qualified professionals, who know their onions to really begin to venture into those areas. So what led me to that? So it's rigorous training. So 200 level to 400 level, you are opening up cadavers. You are, from the head to the toe, so you know everything about the human body. So 300 level, more cadaver training, physiology practicals, you do a lot of practicals. Then 400 level, you switch over to the hospital. So you're seeing patients, and then you're going around ward rounds, all of that, it's the whole training, the whole 9 years. So it used to be 5 years. Now the program has been upgraded to 6 years. So you do 6 years in the university. When you come out, you do 1 year of compulsory internship training in a government and an hospital that is training to physiotherapists. You do 1 year of that before you then proceed to do the mandatory national youth service. So in all, you are spending 8 years, 6 years in the university, and 2 years afterwards before you can get a full license to qualify to practice. It's not a subservient profession. You are a full-fledged medical professional with your license to practice, and you can make autonomous decisions. Another way you can practice like I am, you can establish your own physiotherapy practice. As long as you are a licensed physiotherapist, you just go to the Lagos state government, find out what their regulations are. You can open up so you can, just like a doctor can open up an hospital, a physiotherapist can set up a physiotherapy clinic. So there are lots of opportunities. If you don't want to, you can set up your own physiotherapy clinic, you can set up your gym, you can set up your exercise center, you can decide to work in an hospital setting, you can work with children with disability, you can work with sports. If you're a man, because most guys sports aspect, because if you are the physiotherapist for, let's say, Man City now or Arsenal, you know how much you are going to be raking in as salary. So there are lots of opportunities, in the profession. There are a lot of opportunities. So I believe I've answered that, what it takes.
Wow, it's so enlightening.
Physiotherapist. And I must also say, because some people don't know a lot of things about some courses, as a healthcare professional, if you are someone that you have a phobia for seeing messy things, because I've been treating a patient before and he defecated all over my treatment table. So you can't be someone that you can't be someone that is put off by things like that. So because those are some of the other personal what would I call them now? Personal preferences, or some people say they can't. If you can't see blood, I don't really think physiotherapy, because those are things you are going to be dealing with day to day, day by day. You're going to be seeing blood, you're going to be seeing body fluids, you're going to be seeing injuries, you're going to be seeing arms that, are almost cut off, maybe just hanging by a thin thread of flesh. You're going to be seeing a lot of those things. As I said, part of the training, you're going to be in the same room with dead body to open it up. They are not to open up cadavers, dead bodies. So if you're someone that is put off by things like that, you may want to be considered. But if you feel that you are in, because even from when I've been young, I've always been enthused. I've been blown away by how the human body works. I've always wanted to, go in there, see how blood is flowing, how the heart is pumping, been fascinated by things the child. So some of those things can be pointers. Career, this is a career seminar. So there are some things that are also pointers to, your career. If you are fascinated about the human body, you want to know how it works, you are not put off. As a child, I've never been put off by the sight of blood, no. And in fact, I've been fascinated by that. I've always wanted to know more. So those are things that can help you, as if you want to be a nurse, for instance, you care for people, you don't want to see people, you want to make sure people are comfortable. I have a nurse that told me, even if she's not being paid, nursing for her is a calling. And it shows in the way she takes care of. I mean, you need to see the way she takes care of her patients. She said it's a calling. This is what she has been called to do.
Well,
When she backs a patient, the patient cannot get up. Maybe your leg is hanging, slap the patient, cream the patient, comb the patient. Know that there's a difference in the way this nurse, so it's a calling. Being in the healthcare professions, any one of them is a calling. It's a calling. You have to love it. You have to be passionate about it and give it your very best. So those are the things that I also want to let them know. You're going to be seeing blood, body fluids, opening up patients, things like that. So you have to read that. So it's a full-fledged medical profession. Yeah, so because I needed to say.
yes, and that answered one of the questions about what they need to know about choosing their career paths and discovering, building on their natural strengths. Thank you so much. So,
All right, ma'am.
what do you wish you knew before you started your career in therapy?
That's a great question. What do I wish I knew
You wish you knew,
before I started?
right?
Hmm. Let me see. Well, I wish I knew how demanding the training was going to be.
Mm.
Because I remember at a point when I was in, I think, 200 level, I remember sitting down in one part of the college of because it's really demanding. The training, especially those initial courses in 200 and 300 level, where you are being exposed to new concepts about the human body. It's a lot. You have to cram. Hmm. Let me give you an instance now. The brain, or the skull. This skull, our skull, is comprises of how many bones? I think about 50 some bones, different bones. Supplies it bone, the nerve that supplies it bone, the so just a topic, the eye is almost about 50 pages. You have to know everything about the eye. And we do that for all the body parts, from the strand of hair to the sole of, you have head and neck, you do head and neck, you have the limbs, you have the upper limbs, both hands, you learn about the two limbs, the lower limbs. Then you now come to the internal, you have the thorax and abdomen, comprised of the lungs and the stomach. Then you have the reproductive segment. Then you have the blood. So it was rigorous. So I wish I had known how tedious, how rigorous those, because we had to read a lot, and how it would be. Another thing I wish I had known was how time consuming it could be, because you really don't have time. And that's why people feel that doctors they are not fun people, they are not outgoing, they don't attend parties. We really didn't have time, because when you look at the amount of work that you have to do, although it gets easier when we now graduate, you can now begin to talk about, but even at that, there are some settings that you work in that you still, it really takes it. So you need dedication, you need to be passionate about it. So I wish I had known that. And then what else do I wish I had known? I wish I could have attended a seminar like this, where somebody gave me the lowdown of everything physiotherapy. I think that would have helped me to make more informed decisions about specializations and opportunities that I want to go into. Yeah, because I just went in with the general, although I spoke to somebody, but it wasn't a seminar. He just gave me a little of a time, asked 1 or 2 questions, and that was all. Not an in-depth seminar. So I really want to appreciate you and your organization for putting this together. It is so, so vital. So that's one thing I wish. I wish I had a seminar like this
Thank
done,
you.
where a physiotherapist who had been in practice. I talked to somebody who was in her final year
Oh.
at that time. Yeah, so I didn't even talk to somebody who was already practicing. Okay, but now I'm practicing. I've practiced for almost 10 years. So at least I know a bit of what goes on. So I think those are the things I wish I knew. I wish I could have spoken to somebody who had practiced and then have a lowdown. So those are the things I wish I knew. That's all. I think that's all.
Wow, that's powerful. Thank you, Ma.
Yeah. Yeah. So thank you.
I
Thank you
really
to you for what you're doing.
welcome, Ma. Thank you for showing
Yeah.
up and making it possible. I'm already excited about what the value will be for those who would watch this. It's going to go a long way. So what internships, and okay, you spoke about internships, but are they internship courses, volunteering opportunities you recommend for them, apart from the one that they get, the one the school arranges?
Okay.
Yes, and then what communities or unions should they join online, physically?
Awesome. That's an awesome question. So, excuse me. So for the internship, graduate from school, usually it's the students. I don't know as at now, but latest I heard is still the students who will go to apply at different hospitals to apply for internship. So generally, all government hospitals where there's physiotherapy, all teaching hospitals where there's a physiotherapy department, they are accredited by the federal government to provide the mandatory 1 year internship. And let me also add that during your internship, you are paid handsomely.
Oh,
So
wow.
as a physiotherapist, fresh graduates, I mean, you are earning. Don't let me say the money so that armed robbers will not come and be looking for. Just on a lighter note. So your internship is a fully paid 1 year of work, and a matter of fact, many physiotherapy graduates and a healthcare professional, that's our shakara year for all the hard work
Yeah.
and all the stress that we went through in
It's good.
school. Yes, because usually you are not yet married, there are no responsibilities yet. Usually you have accommodation in the hospital, and then you are earning a lot of money, almost 200,000. As at then, I don't even know what it is now. So it's a time that many physiotherapists do a lot of things, plan. Many people go on to, begin to work with some people that want to travel out, people that want to do their masters, people that want to, go forward with their studies. So your 1 year internship is paid. Every government tertiary institution that has a physiotherapy department is accredited by the federal government to provide internship. So you just apply. Some of them do exams, some of them do interviews, oral interviews, and written exams. So get the interns that are going to work there. So that's how it goes. In all states of the federation, including the FCT, there are hospitals accredited by the federal government to provide physiotherapy internship. And there are also a number of private hospitals also that have satisfied the conditions to be a hospital to render. All right. So at the point of in getting inducted, induction is what we call our own graduation. Apart from the university's convocation, if a therapist student that has completed a course successfully, we have what we call the induction ceremony, where you are inducted as a physiotherapist. That's different from the university convocation. So you have people licensed physiotherapists at that level. So you are going to be given a handbook that contains all the hospitals where you can apply for your internship,
Oh, wow.
information you need to know, contact numbers, and all of that. At that point, also, yes, you also be inducted into the Nigeria Society of Physiotherapy. That's the NSP. So yes, you're going to be inducted into the NSP, and then yearly you'll be able to participate in the annual conferences, audience exhibitions, conferences that take place in different parts of the country. So that's where you go, you network with other physiotherapy professionals, both within the country and those that come from outside the country. So we have where we talk about new trends in the profession, latest trends in healthcare, things like that. But the board that certifies student physiotherapists to become full-fledged licensed physiotherapists is called the Medical Rehabilitation MRTBN.
Okay.
Area. They have their head office at the medical compound at Yaba. So they are the ones that give you the license. They are the ones that go around and certify that, oh, this physiotherapy hospital is licensed to operate and things like that. Now online there are a lot of international healthcare communities that physiotherapists can join. One of the popular ones are the ones that involve a stroke. So we have the Stroke Care International. Physiotherapists are always needed to volunteer, provide awareness. We have the World Confederation of can register. We have the West African Physiotherapy Association, WAPT. So there are lots of communities online. Stroke International, Cancer International. There are communities. Those around a certain condition, a certain medical condition that always need physiotherapists to be part of, their career. So there are a lot of them. Just go on, like there are stroke care, hypertension care. There are a lot of them, so that you can be a part of. All right. So there are countless of them online. But I am part of Stroke Care International. Is a community of physiotherapists and other healthcare providers that seek to provide information, counseling, and guidance and resources to the general public for those struggling with living with stroke and their caregivers. There are number of all that.
Wow. Wow. That's a lot of um, opportunities to connect with other people in the field. Thank you. So you've mentioned some of the skills and
Yes, a lot, a lot. And technology has, made the world a global village now. So you can, I mean, there are a lot of courses you can do from the comfort of your home here in Nigeria, and then become part of reputable organizations. So there's a whole lot.
Wonderful. Thank you, ma'am. Thank you. You mentioned some things
You're
about
welcome.
yes, but the skills. I know you talked about communication, being able to empathize and all of that. So can you list what skills and competencies that teenagers seeking to work as physiotherapy should build actively?
Okay. So I lost the last part, but I believe you're asking me about the skills that
Hello?
competencies
Yes,
that teenagers need to have to
yes,
become good physiotherapists,
yes,
right?
yes, to build.
Excellent. Okay, so apart from the ones I already listed, let me start from the medical aspect, and I'll come to the personal aspect. So medically, you have to have an eye for details. You have to be able to pick light things. Sometimes patients come to you, and then beyond what they are saying, as a physiotherapist, you need to be able to pick details. So for instance, let me share this experience. I had a woman come in once with a very swollen knee. And then she said, "Oh, I just had a fall. It's nothing serious. It just got swollen, blah, blah, blah." And then I touched the knee, shouted a lot of pain. I said, no, I asked her, did she have a fall? She said, no, she can't. I think she just slipped a little. It was nothing major. By the time I sent her for an X-ray, we found out that her patella, that's the bone that covers the knee, had broken into two, directly broke into two parts, and they are now began to question what exactly happened. Oh, she actually fell into a gutter. And so you have to be able to, keen attention to details
Wow.
is very, very important as a physiotherapist. You have to have excellent palpation skills. By palpation, we mean when you touch, you touch a part of the body or an organ, so have a feel of what is going on. So medically, as a field, because in fact, in physiotherapy, we say that our hands, our most valued and treasured instruments of work. A physiotherapist is a handy person. You be touch a lot, so you have to have excellent, palpation, because sometimes it's just by touching a part of the body that you can know. Oh, probably there's a fracture here. Probably there's dislocation here. Probably there's an infection here. So you have to have good palpation skills. By palpation, that's touching, handling. You have to be someone that you are not afraid or put off or disgusted by touching people. You are going to touch people, all parts from head to toe. So you have to have good palpation skills. You also have to have good evaluation skills. That's ability to, okay, based on what a patient has said and based on what you've gathered, the information you've gathered during your medical examination, how do you now arrive at, okay, this and this is what is going wrong with the patient? So critical thinking and good evaluation skills, ability to make decisions, decisions as an autonomous healthcare professional. Okay, so you need to be able to do that, be able to fact finding, we call it taking history as a medical, so take history from the patient and then combine that history taking with examination, physical examination, to be able to arrive at a conclusion that this is the problem with this patient and this is what needs to be done. You also have to be able to be, okay, let me switch now to personal skills now, or just competencies. You have to be an excellent player. Remember, I said that physiotherapist is a part of a healthcare team. You need to be able to work with other healthcare professionals, knowing that the patient is the center of attention. So you can't be someone who is aloof. who feels, oh, I don't need anybody else, I can be all by myself. No, we all need each other when it comes to taking care of our patients. So you have to be an excellent team player. You have to be an excellent communicator. That one is a plus plus. You have to be able to communicate both with the patient. Sometimes, especially when it comes to parents and children, parents come in, they are so agitated, they are anxious. Will my child be able to walk? Maybe he had a fall at school, he's bleeding, they are anxious. You have to be able to calm them down. You have to be able to work well under pressure. I think this is both a personal skill and a medical. Sometimes parents can put you under pressure, patients can put you under pressure. You have to be able to work under. For instance, Mr. Ganyu now, he wants to go back to work. He's the breadwinner of his family, and yet his fracture is not yet healed. But he's eager to throw away the crutches and just start working. He doesn't care. He wants to go back to work. You have to be able to calm him down, be able to speak reason to him. You have to be able to, just come in and let him know that he's slow and steady. Before he knows it, 6 weeks are going to be over. So communication is so, so key as a physiotherapist. You have to be a person of integrity, especially when it comes to working with the opposite sex. There are times that you have to attend to patients. Maybe if you're a woman, a male patient, maybe he has pain in his buttock. Now you have to be, level-headed. You have to be professional. You have to be someone of integrity. Of course, moral standing, character is mandatory for everybody in the healthcare professions, because people are going to be exposed in your presence. You have to know how to approach patients, make them comfortable, and not make them feel as though you are taking advantage of them. Empathy, very important. You have to be empathetic as a physiotherapist. So your patient, you are doing a particular procedure which medically is beneficial to the patient, but is also causing some pain. I'm saying, madam, don't you know I'm doing this thing to benefit? No. Oh, sorry, ma. There are people have a lot of experiences with nurses, doctors, healthcare professionals, and say they didn't even care about how I was feeling. They didn't even, they didn't even know how I was feeling. But as a patient, I'm a physiotherapist. There have been times in my life where I've also had to be on the bed. For instance, when I gave birth to my son, I had to know it's heartwarming when your healthcare provider is empathetic. Oh, madam, how are you feeling? How are you doing? Oh, we know this is painful, but you have to just enjoy. It's going to be over soon. So as a physiotherapist, you have to be empathetic. You see, I'm even already feeling empathetic as I'm talking. Because pain is not nice. So you have to put yourself in your patient's shoes. You have to understand with them. You have to, encourage them, feel what they are feeling. It is very key as a physiotherapist. So I think basically those are and you have to know your onions. You have to know your medical, your medical, your subject. You have to know your onions. Some people have met physiotherapists that they feel like, this person doesn't really know. He just wants to massage me. But when you meet a physiotherapist who knows, medicine, who knows, what he or she is doing, is an added plus. So I want to encourage you have to know your onions, really know what you're doing.
Wow.
So basically, I think
wow.
These are the major.
You made physiotherapy very attractive right now.
Do you want to be a physiotherapist?
I don't know. Maybe I'll encourage someone. Because I know I wanted to be a neuroscientist at a point, or a neurosurgeon, because I read Ben's book, and it's funny, whatever these children see, or whatever we saw as children, that's what we want to be. So it's going to be powerful seeing someone passionate and someone they can look up to as a role model. Thank you so much. Thank you so much. So what do you think recruiters in your industry are looking out for in applicants, either for internships or job positions, for those who don't want to do it private practice? What do they want to see?
Basically speaking, I think recruiters will want a physiotherapist who can work well under pressure, and who has excellent what's the word I'm looking for? Excellent ability to assess a patient, diagnose the condition, and come up with a treatment plan. Ultimately, it's about taking the patient from point A, the point of illness, to point B, the point of wellness. The processes in between are the discretion of the physiotherapist. So I believe a recruiter wants a physiotherapist who has excellent an outstanding assessment, diagnosis, and treatment, skills,
Wow.
to take a patient from the point of illness to the point of wellness. That's just in summary. And of course, we have the soft skills that all employers look out for, your communication abilities, well under pressure. But when it comes to physiotherapy, those three things, you are able to assess a patient, do a comprehensive physical examination of the patient. You are assessing your ability to use that information that you have gathered to come up and diagnose that, okay, this is what is wrong with this patient. And then to follow that up with a treatment plan that will actually deliver that wellness, that treatment, that improvement in condition that the patient needs. I think those are just the main things that recruiters will be looking out for.
Wow. That's really
Yeah.
powerful. And you have succeeded in your private practice. You've worked in um, government hospitals and all of that, but you have succeeded. So what would you say? What do teenagers need to know about, or aspiring physiotherapists need to know about the business of physiotherapy?
Awesome. So let me say that relationships are very important. Most of the patients that I see now in my private practice are patient and relationships, and then consistently giving value. In fact, let me start with value, because people that say, "Oh, I'm not getting," and this is not even just limited to physiotherapy alone. Anybody that says, "Oh, people, I don't have customers," whether you are a barber, whether you are a tailor, the first thing I say is, "Are you giving out value?" Because naturally, once you are giving out value, people are going to want to come to you to get that value and exchange whatever for the value. For instance, let me just give a funny example. My husband and I, when we moved to this place, we needed a good tailor for their clothes, for the boys, my husband and my son. And I just saw this guy not so far from my house. He put out a sample of clothes and it looked good. So I said, why don't you try him out? The first clothes he sold for my husband and my son, we were completely blown away.
Wow.
Excellent tailor. All the materials that I had inside the house for my son, I had to pack just so. I didn't even give it, just so. It's an exceptional. So because he has given back, now if I know somebody in this area who wants a tailor now, I don't have to crack my head and think I'm just going to refer him. So that's where value and relationships come in. So as the business of physiotherapy, number one, deliver consistently excellent physiotherapy services to your patients. Is going to be a good springboard for you in your private practice. So now most people that call me and that need physiotherapy, they say, "Oh, somebody so and so gave me your number, that you treated her, you attended to her or to her son or so, and they recommended you." That's the major way that I get patients. It's usually based on a referral from somebody who had a previous interaction with me. If I'd been shoddy at my work, if I hadn't known what to do, or if I'd been had not been empathetic, been a good communicator, develop a real relationship with my patient, they won't even remember me enough to have my number. In fact, they won't even have my number to say they want to, because there are times, I call my patients even on days that they didn't come to the clinic. "Oh, I didn't see you today. How are you?" Sometimes I remember their birthdays. Sometimes I celebrate a milestone. We've had victory dances together in my office. Maybe one of my patients, she threw off her crutches and she started walking. We have a victory dance together. I've had lunch with my patient before. "Oh, let's just go and celebrate." So it goes beyond just doing something for the money. If you are consistently making a difference in your patient's life, there's no way that they're not going to refer people to you. So just like I said, consistently deliver value, consistently deliver excellent physiotherapy care wherever you're working, you're finding yourself. That is going to be a springboard for you. And then, of course, your reputation as a physiotherapist. You don't swindle patients. You don't talk anyhow to patients. You don't disrespect people. You see some people, I've gone to some hospitals, I had to tell the person, I'm also a healthcare professional, that somebody is coming here to seek care. It's not because they are happy with the way they are. It's because of the pain, that they came here to seek it. There's a way you talk to them. You see some people just talk down on patients. A patient is there, he's in a lot of pain, waiting for 2 hours. Nobody has come to attend to him. Nobody has come to say anything. He's just sitting there in the reception. Even if he has to wait, or if somebody is coming every 30 minutes, "Oh, madam, we're so sorry. we are walking to, somebody is going to be with you, just please bear with us. There's a way now. But you go to some health facilities, nobody attends you, just sit down, you're waiting for hours. And then by the time you finally go and see doctor, he doesn't even look at you. He doesn't even care that you have been sitting there for 2 hours. Yes, what can I do for you? Doctor, I'm having headache. Oh, headache, paracetamol. And then 5 minutes. So you sat down for 2 hours to have a 10 minutes consultation with the doctor. It's absurd. So those are the other things that will stand you out. Apart from having excellent medical skills, your people skills, your people, how you attend to patient. Oh, a parent comes in. Where I did my internship, when I left the place, parents, of course, I handled the pediatrics unit because I love working with children. Those are one of my personal skills. Whether in church, whether in the office, I'm a children's people. So they left the pediatrics unit to me. When I left, the mothers were calling me, Miss, I was not married. Miss Samoto, oh, we are not going to their clinic again. All the children miss you because before we start the treatment, we first dance, we first sing, we first play with the kids. I sing their nursery rhymes before we even start the treatment. So it's, so the mothers, they had trust in me. They were comfortable. So your people skills, those are the things that will now, because sometimes you can have 10 physiotherapists that are all excellent when it comes to the medical skills and diagnostic skills and all of that. But then one physiotherapist she's friendly, she's jovial, she empathizes with patients. Of course, people will prefer to work with that person more than somebody who knows the onions but doesn't have a good manner of approach. So everything has to be balanced. While you work towards being an excellent physiotherapist when it comes to the medical skills and all those things needed, your people skills, your soft skills also, your accessibility, approachability with patients, your ability to empathize with them, your ability to relate with them, build relationships that they can trust you. Sometimes a patient comes into my office who is usually jovial, who is usually happily disposed to have a treatment, and then that day she's just looking down. I don't just say, okay, lie down and let's start the treatment. You're not looking like your normal self today. What's going on? And then the children, maybe something happened at their school, is down about it. Because if you don't attend to that first, it's going to affect the. It's very important that you merge the excellent medical skills with excellent people skills. It's going to really help, especially in your private practice. People are going to keep referring patients to you because they can vouch for your skills, that's your medical skills, and they can also vouch for your people skills. Yeah, so that's going to. And also you need to learn about business. So as the physiotherapist, for instance, I take courses from Enterprise Development Center from Pan Atlantic University. I read about business entrepreneurship. So you need to add those skills for patients. It does not necessarily translate that your business as a physiotherapist is going to, so is going to blossom. So you need to know, key business skills. How do you start a business? Publicity, how do you create the awareness and things like that? So you need to also get, all those skills. So those are the things that are going to help in private practice.
Wow, that's a business class. Thank you so much.
You're welcome.
So we're hearing about a lot of changes coming underway because of the technological advancements going on. Yes, and how is it affecting your industry? What will change in the next few years, and how can they prepare for it?
Awesome. I love that question. So let me start by saying, for instance, during the COVID period, many people were afraid of going to the hospitals, because of the fear of catching the COVID. And then we started telemedicine. So telemedicine is one trend that has come to stay, now, because patients find out, okay, just the way I am here with you, I can actually, have a kind of mini consultation with my patient. Now, while that works better for people like doctors, those of us who need to have hands-on treatment with our patients, for instance, a dentist, an optometrist. A doctor can assess you on phone like this and just send you a prescription of the drugs that you need to take, how you need to take them and all. But there's a limit to how we, for limits to that for us as physiotherapists, because I can't touch your shoulder on the phone. I can't massage your back on the phone. But at least telemedicine is a way now that we're trending, where you can actually consult with a patient, and then for us as physiotherapists, we now combine that with home care. So instead of, since the patient, the risk of getting the COVID is high in the hospitals and all, we prefer now to see patients in the comfort of their own treatment, when they get the treatment in the quality, in the comfort of their own space. So that's one of the things that is going to be a good disruption, to the physiotherapy business in the coming years. With technology, we're going to just be combining telemedicine, where you consult with your physiotherapist via phone like this, the video conference, like this, and then you now get the physiotherapist come to meet you in the comfort of your own home, put you through procedures, and even most importantly, adjust your home to fit your condition. For instance, somebody when recovering from stroke now, if I was to go to their houses, the way I'm going to help them with how they maneuver the staircase, with how they reach for things. So I'm going to adjust their, if it's a woman, for instance, I'm going to work with her to help her kitchen be more accessible. For instance, if my patient recovering from stroke has some shoulder limitation, that she can't stretch her arms fully up, as a physiotherapist, if I'm providing care for her in comfort of her home, I will go to her kitchen. All the ingredients she uses on a daily basis, I'm going to find a way to put them within arm's reach, adjust things to make it comfortable for her. We find that her recovery will be better. She'll be able to have the quality of life. She won't want, each time she wants to cook, she won't start being depressed that, oh, before I had this stroke now, I could move around easily, I could do. She will have that peace of mind that, okay, even despite the fact that I'm recovering from a stroke, I can still do the things I used to do before. Although there's a specialization in medical rehabilitation called occupational therapists, who actually major in that.
Okay.
So under medical rehabilitation, you can either choose physiotherapy or occupational therapy. Occupational therapy is not so common yet in Nigeria, but they are in high demand abroad. They will go to your house, they will go to your office and adjust the space to match what your physical, yes, they do that. They go to your office, adjust your, anything you need as per your condition. So for physiotherapy, we can also do a little of that with our training. So that's what I feel that, technology, the COVID is going to, now that there's a limitation on crowd gathering, massive gatherings, a large number of people, which usually happens in the hospital. Most people are going now towards getting care in their own space, in their own homes, and also getting care, via technology means like video consultation, telemedicine, and things like that. So that's what I see. That's what I see. And I also see, just like the app that we're also working on, I know there are also going to be a lot of novel things like that that will connect patients with healthcare givers. Yeah.
Wow, this is so much value.
It's a pleasure. It's a pleasure.
This is the last
Yeah.
question. In fact,
Okay.
it's powerful. What advice do you give to these teenagers? What advice do you give to them based on everything? And I just want to go back to some of the things you said about being passionate, about knowing what they're passionate about, and some of those things. Now, as you are speaking to them, also look at those who are in art class, because and those who don't get admission, these two people, because I've been at trainings with teenagers and they'll say, and they're giving science students more preference. So generally, about aspiring to be physiotherapists, what do you have to say to the teenagers now?
All right, thank you so much. Having said all of this that I've said above, the first thing I want to say to teenagers is that at the teenage age, while you may not know in detail, the entirety of God's plan for your life, you need to begin to have a picture of what your future, what the kind of future that you want to have. Whether you are in sciences, whether you are in arts, whether you're in the commercial combination, begin to have a mental picture of what the kind of future that you want to have. And this will be hinged on 2 or 3 factors. Number one, the revelation that God gives you in your heart. Our heart is our compass. You know, it's just if we will all be true to ourselves. Our heart doesn't deceive us. Deep down, God has given every one of us, religion, nonetheless, a compass within that you can follow in its truest form that will lead you to where God wants us to be. And I want you to know that one of the things that following your heart does is that, it will your heart in its truest form will show you who you really are, what your strengths are, what your inclinations are, what your passions are. And if you can discover that early at this teenage age, I'm telling you, 70%, of the stress that people go through later in adult life, you have taken care of it. So, number one, in finding out and creating a mental picture that you have, number one, the revelation that God gives you about yourself and your future. Number two, discover yourself, your strengths, your natural strengths. What are the things you like? I can be here now talking about this physiotherapy. It's not been an issue to me. I look forward to it. It's not a stress. What are the things you like? What are the things that, that keep you awake in the night? What are the things that if you are going on the street of Instagram, you see that thing, you post, you want to read that post. What are the things that make you come alive inside? And in that conversation, I want you to block out every other voice. Because as a teenager, like I explained to you when we had the first discussion, there's a lot of pressure. Your parents want you to do this. Society wants you to do this. In fact, thank God now things are changing. In our own days, if you are not a science student, people believe you are not brilliant.
Yes.
It's a lie. From the pit of hell, permit me to say, because that thing has cut a lot of people off from what God actually intended them to be. What do you want to say about Chino Achebe? He wasn't a science student. Bode Soyinka, a Nobel laureate, wasn't a science student. And the list goes on and on and on. So the second thing is, as I said, now I'm talking about 3 points that will help you to draw up a mental picture. You may not know it in detail because you are still a teenager. There's a whole world ahead of you. But I want you to draw up a mental picture, something like a roadmap that can guide you on the, to guide you to the kind of destination that you have in mind. So number one, the revelation, the things that will help you come up with that picture. One, the revelation of your future that God will give you. And there's nothing difficult about it. You just have to ask God about it. That's one. Number two, close the windows of your mind to all the other voices and sit down in a quiet place. Take a notepad with a pen. What are my strengths? What do people compliment me for more? What are the things naturally that come to me that I don't even think about it, before? What are my natural strengths? I don't think about it before I do. It just comes naturally to me. And people make a big deal of it. And to me, it's not a big deal. For instance, now, Stephanie thinks this interview is a big deal. To me, it's not a big deal. I'm having fun. I'm enjoying myself. I've looked forward to it. I love it. I love communicating with people. I love sharing what I know. I love talking with people. So what are your natural strengths? What are the things that fascinate you? I mentioned during the course of the seminar that right from when I've been young, I've been fascinated about the human body. I always want, in fact, all those shows, Discovery, all those things, I'm always happy when they are showing how they are doing surgery, how they are, oh, wow. That's a pointer. So I want you to sit down. In fact, before the year is over, a new year is coming, sit down with a pen and a paper in a quiet place. Forget about what mom is saying. Forget about what dad is saying, all the expectations of it. What do you really want? What would make you happy? When you are 50 and you wake up and you're going to your job or your business or your practice, what do you look at that? I'm going to be waking up with joy. Those are the things. That's number two. So one, revelation God gives you. Two, an honest appraisal of your natural strengths, your natural inclinations, your natural passions, your natural fascinations. That's 2. Finally, number 3, because sometimes also, especially when you have people around you who can be honest and objective with you, sometimes the people, selected people now, can also help you sometimes see the value in what you just think is ordinary. For instance, I sing. Sometimes I sing and I hear myself when I sing. My voice is nice, but when some people hear me, they're like, wow, that's amazing. My mom has a proverb in Yoruba that says, Ori konrojuri rai. That means a lantern is giving light to the whole house, but he can't see himself. Sometimes God gives some people an ability to see us beyond our circumstance and see the good. Sometimes things that we can't even see in ourselves. So if you have people like that in your space, you can ask for their honest appraisal. What are the things? And if people 1, 2, 3, 4, 5 people keep commending you, keep you do this thing really well, and so you just a normal, just enjoy doing it, it's just fun. Those are the things you want to look at. So those are the 3 things that can begin to help you to draw out a picture of the kind of future. So when you have that picture, it now begins to determine your decisions, your actions, your commitments, where you invest your energies into, where you invest your times into, your friends, the kind of friends. Having a picture, and let me extrapolate from the Bible, just like Joseph. That kind of picture is like the dream he had, that first dream. He didn't know the details. He didn't see Pharaoh in the dream. He didn't see Potiphar's wife that was going to entice him in the dream. He didn't see himself when then they cast him into the pit. He didn't see all of that in the dream. But he just had an idea that since I'm going to be a great man, I'm going to be a leader of some sort because people are buying down to me. In today's parlance, I could see, if I was a Joseph, I could think probably maybe politics, maybe leadership, those are things. So that when he first had the dream, it was I think 16, 30 minus 11. I think it was 16 thereabouts. He became the prime minister at the age of 30. Look at the timeline. But you can see the way that having that dream at that young age helped him to avoid pitfalls, helped him to stay focused. When Potiphar's wife came to entice him, I'm sure it's one of those things. I'm going somewhere. This is not the end because I have a picture. So it's, as a teenager, it's so important. I can't say, but you have to have an idea, have a picture of where, because that is sums it up. It will determine the kind of friends you keep. It will determine the kind of places you go. It will have an overall effect on the quality of your life and decisions. It will determine how many hours you want to read per day. It will determine the courses you pick, the online trainings you want. It will begin. It's like a compass. It will begin to nurture you in the direction that you're supposed to go. So you don't need all the details, just the picture, just the idea, and then you now begin to channel your energies in that line. So that's what I really want to say. As a teenager now, have an idea. It will take its toll on your character because there's no way you know that, okay, I'm going somewhere high and then you want to be a crappy person, you want to talk anyhow to anybody, you won't want to pay attention to how you relate to people. No, it's going to. So I just see it as one door that will take care of all the other doors. One door that leads to other rooms, one key that opens, that will help you sort out everything. So number 1, as I said, it's important to have a real relationship with God, because the Bible says we should remember our Creator in the days of our youth before the evil days come. So because it's when you have that relationship with God that He can speak to you, begin to nudge your heart in the direction that you should go. Number 2, having the honest appraisal of yourself, your passions, your abilities, your strengths, your skills, the things that tickle your fancy, the things that that make you come alive, the dreams. Just it's simple. We just need to be real. We just need to be true. Deep down, each of us know that thing that we really want to do, that will really make us fulfilled. It's pressure that has made many people cave in. Pressure from parents. So just blank out every other person. Just you and your compass in your heart. What do I want? Honestly, appraise yourself. What are the things that come naturally to me? And then use all of that to now begin to navigate, going forward. And then have people in your space, just like this seminar. I'm sure you have a platform where the young people can talk, can ask questions. You can give them appraisal, match their skill set with their preferred course of choice, things like that. So have people in your space as mentors, people that you can talk to, that can also guide, because guidance is very essential at the teenage stage. So that's basically what I feel led to just say in closing.
Wow. Wow.
Teenagers.
Thank you so much. That was such a powerful way of summarizing and summing everything up. And I'm very sure that for many, just you could be having those pictures and you ignore them, but it's really shown the power of it and taking us on a journey through physiotherapy. I've never imagined physiotherapy to be this powerful. Thank you so much, Mrs. Bolagun. We're grateful, and we look forward to having you some other time.
Hello, are you there?
Yes, I'm here. Can you hear me?
Okay, I can hear you now. I didn't hear the last.
Yeah, so thank you so much for being with us today and giving so much value, opening our eyes to so much, and really look forward to having you another time. That was great.
I look forward to being here. Anytime you need me, please just call on me. I'll carve out time. I look forward to being here. Thank you for the opportunity and for the privilege to do this. I really appreciate it.
Thank you so much.
I really appreciate it.
Thank you. All right. So please expect your comments, your likes, and remember to subscribe to our channel. And you can find Mrs. Bolagun on social media. By God's grace, we'll have other things that will come up with time. Have a great day. Bye.
Bye. Thank you so much.
Thank you. Okay.